Hello, mommy. Welcome to my channel. Ultrasound scan basically helps to know the state of the pregnancy, the condition of your baby, the position of the placenta, and a whole lot. So there are three important ultrasound scans that you have to take. I'll take them one after the other and explain. The initial abdominal ultrasound scan is the gestational age. You will take abdominal ultrasound scan to know the age of your pregnancy. It's advisable to take it within the 10th week to the 14th week of pregnancy. You can take it early, but when you take it early, you might not get the accurate findings because before the 10th week, the embryo is now developing into fetus. So there are other related conditions that can also pop up, like the ectopic pregnancy, the missed abortion, and other conditions. So it is advisable to wait till the 10th week of pregnancy through to the 14th week of pregnancy. That gives you accurate information, gives you accurate findings that you are certain, and it gives you an assurance that your pregnancy is healthy, it is in a good state. Do you get it? And so you can take it early, but when you get to the 10th to the 14th week, it's advisable to take another scan for you to get an accurate information about the position of the placenta, the accurate EDD, that is estimated date of delivery, and then it also gives you an accurate age of your pregnancy. The embryo has developed into fetus. There is a little head, a little legs, a little abdomen, and there is presence of fetal heart rate. And so at that time, everything is certain. The placenta is also developing, and so it gives you a bulk information. It's in obstetric, we calculate the pregnancy with weeks. And so the first day of your last menstrual period is same as a month or 4 weeks. And so when you take the scan, maybe you'll be expecting to be in your third or your fourth month. When it comes, it's in the fifth month. Don't be worried. We calculate it the first day of your last menstrual period. That is how we calculate it. So how many scans are you expecting to have? Leave in the comment section. I want to know. 2, 3, 4. I want to know. Leave it. If you have already taken your first scan, I want to know in the comment section. Okay. So the second one is the anomaly scan. So ultrasound scan for fetal anomaly, the fetal anatomy. You want to know the state of the vital organs. So the ultrasound scan focuses on the vital organs, the head, the face, the heart, the brain, the spinal cord, the little abdomen, the kidneys, the liver. The scan focuses on these organs, takes them one after the other and analyze to see if there are any abnormalities, if there are any developing conditions. The scan will be able to detect most of the conditions. The ultrasound scan will be able to detect. And so if the ultrasound scan detects some abnormality, your midwife or your obstetrician or your doctor will discuss on how it will be managed. Don't be alarmed, okay? If there is a need for you to terminate the pregnancy, it will be discussed with you. If there are some labs that you have to do, there are some treatment that you have to embark on, all these things will be discussed with you by the midwife or your doctor. Okay, so it is important for you to take the anomaly scan. Never forget to take your anomaly scan. It should be taken at the 18th week of pregnancy through to 22nd week of pregnancy. That is the range. There are some conditions that can be managed, and there are some that the pregnancy should be terminated to save you from a lot of stress. Okay, So when it gets to that time, but I hope that you watching, there won't be any condition. Your baby is healthy. That is what we are all hoping for. A healthy baby and a healthy mother. So the third one is the late scan. That is the late ultrasound scan. And it is taken around the 36th week of pregnancy. That is the 9th month. Because that time, pregnancy is about to end. Baby is ready to come out. And so we have to know the state of the baby. We want to know the weight of the baby. Because there are some babies that can't be delivered through the vagina, or mothers can't have a normal vaginal delivery unless a cesarean section. And so it is important to know the weight of your baby. If you're first time mother, or if you're a diabetic mother and the baby has a huge weight, your midwife or your doctor will discuss with you. So it is important to know the estimated fetal weight. Your doctor will ask you to take the late scan to know the state of the placenta, whether it is low lying, it is anterior, posterior, or it is high. When it is low lying, there are some conditions down there. I'll talk about that, the low lying placenta, in my next video, to know the presentation or the position of the baby. Though during abdominal palpation, your midwife can determine the position and the presentation of the baby, but the ultrasound can also give a second view on that. During the early stage of pregnancy, let's say in the second trimester, a fetus can present with the head. That is the normal presentation. But getting closer to the third trimester, the baby can now present with the buttocks, or will present with the hand or the lower limbs, the legs. I really appreciate it. Please share, like, subscribe, so that anytime I post a video, you'll be the first person to watch. Also taking to confirm some findings. Let's say your midwife or your doctor examined you and realized that your abdomen is too big compared to the age of your pregnancy, or the abdomen is too small compared to the age of your pregnancy. You have to do the ultrasound scan to know the volume of the amniotic fluid, whether it is too much or it is less. What is the age of your pregnancy? I want to know. I want to know the number of scans you have taken already or you intend to take. I want to know if you have been scheduled to take a scan. I want to know. Please leave all these comments in the comment section. Please, I really need your comments. These things, decrease fetal movements, decrease fetal heart rate, bleeding. These things are emergency. So that one, you have to go to the hospital for them to take the scan. Other than that, if you want to know the sex of the fetus, you can wait during the late scan. You can wait and then you do the late scan, and they will tell you. Or when you are taking the anomaly scan, you can ask. It's not necessary for you to go and take scan because of the sex of the baby. It's not really important. So these three are the important scan during pregnancy. Thanks for watching this video. I really appreciate you. I'm a Joy Fry Help. See you in my next video. I love you.